Welcome to this tutorial on ACE Advanced Medical for non-medics. This is intended to be what every player who's not a medic needs to know about the medical system. And I want to start by saying this is not an absolute, perfect, came from God set of instructions. The system's much too complicated, and the possibilities of things that can happen in the game are much too complicated to give you a simple list of here are 3 steps that you need to know, and that will cover every situation. Won't happen. But instead, we're going to give you a general approach that we have worked up and feel that it's pretty good information for everybody to know. First thing I want to do is start with the fact that there are 8 different types of wounds in the game: abrasion, avulsion, contusion, crush, cut, laceration, velocity, and puncture, and each of those could happen at the minor, medium, or large wound level. And there are 4 different types of bandages, and each of them is more or less efficient at stopping bleeding, and each of them has a different chance to reopen. Red is bad, green is good in this chart. This can be very intimidating to a new player or someone new to advanced medical. So we're going to boil it down to just 2 bandages, and the elastic and the quick clot. The quick clot is also sometimes listed as the basic field dressing quick clot, which is very confusing because the field dressing is actually known as the basic bandage. Don't worry, we'll talk about quick clot and elastic. Hope that makes sense. So I have a basic grunt loadout of medical gear here on my uniform. And you can see I've got 15 elastic bandages. Those are going to be what I use to stop bleeding on all body parts in all situations, because we're just keeping it simple. I also have 10 quick clot bandages, which you see the confusing name for. But if you look at just the ones in parentheses, it makes a lot more sense. And I have 10 of those because while they are less efficient at stopping bleeding, they are the best at preventing a wound from reopening and bleeding resuming. So as a combination, that's a pretty good combination of bandages. I've also got 4 tourniquets, also known as CATs, which is combat application tourniquet. I've got 4 because I might want to put one on each limb. Tourniquet is basically like a cinch that tightens down around the limb to stop blood from flowing in and out of that limb. When you have a bad wound, like a cut or a velocity wound or a puncture, where there's a lot of bleeding, you want to prevent bleeding while the limb is getting treated. I also am carrying just 1 epinephrine injector. In 1st Battalion, our America's Battalion, the standard procedure at the time of this video is that grunts are not supposed to give themselves epi, that they should seek medical attention from a medic or doctor if they need that. I believe the European Battalion, however, allows grunts to give themselves epi if their heart rate is low, which can happen from taking morphine. Morphine, I'm carrying 5 morphine injectors, is used to stop pain. If you're used to ACE basic medical, you will want to understand that in advanced medical, you pretty much never need more than 1 morphine. And you need to understand that it's going to lower your heart rate, which can make things complicated. You'll start to hear your heartbeat starting to pound as your heart rate gets slower, and we'll talk more about that later. But you're carrying 5. By the way, you might ask, why are you carrying the epi 1st Battalion if you know that you're not allowed to give it to yourself? Well, for one thing, the medic who goes to treat you, or doctor, can use that off of your person. And that can be somebody giving medical treatment to somebody else can take any gear out of their uniform or vest or backpack and use it to treat them. Same thing goes for the saline. Saline is used when someone has lost a lot of blood and their blood pressure is getting low, that can be dangerous, so you give them an IV of saline, and that helps stabilize their blood pressure. The heart can't pump blood if you don't have decent blood pressure. Why are we not using blood? Well, in the game, the truth is it doesn't really differentiate, but for realism's sake, we're going to say that blood would go bad if you were toting it around in the any sort of warm or hot climate. So that's my basic medical loadout. These are the things that a grunt needs to worry about. Let's go on. Let's talk about the medical interface. If I hit the H key by default, or I use the ACE self-interact key, I can bring up the ACE medical menu, and it looks like this. So let's go over the different parts of it. Up here in the top left, we have the examine and treatment section, which is divided into 8 tabs. Let's talk about those. The triage card will show a record of treatments that have happened and how long ago they happened. This is useful because that won't go away. I suppose if it has enough postings it might, but I've never seen that happen. We'll get more of that when we talk about the activity log in the quick view. Moving on, examine patient. At the moment I have 2 options only. I can check my pulse or I can check my blood pressure. We'll talk about that when we start doing some demonstrations. The bandage and fractures tab, the fractures part hasn't come into play in ACE yet, but the bandaging part shows 2 bandages that I have available. If I click on a limb, it also lets me apply a tourniquet, knowing that I have them. But you can't apply a tourniquet to your torso or your head, so when I click on them, it only gives me the 2 bandages that I'm carrying as options. If I click on a limb, the medication tab will let me do inject morphine or epinephrine. Notice that you might think, oh my gosh, I don't have any morphine on me because it's not giving me any option for medications. Remember that you have to be clicked on a limb in order to have that option. You only stick yourself with one of these injectors in a limb. Then you've got the airway management, something not yet implemented in ACE. Advanced treatments, which is for medics and doctors, not for grunts. And the drag and carry icon, which you could use, or you can also use the basic ACE interaction to do that to another person. The last one is to toggle between self and others. And that's when I'm standing looking, or kneeling, and looking at someone else, and I want to go back and forth between looking at my status and looking at theirs. Right now, if I click it, nothing happens because there's nobody in front of me. Okay, so that's the examination treatment section. Status is just the status of your 6 body parts, the 4 limbs, torso, and head. When you click on them here, in the overview, you get the status display. And that'll tell you things like it's bleeding, you're in pain, how serious an injury and what type of injury you have on that body part. Down on the bottom left, you have an activity log, and that will give you a timestamp list of activities that have taken place to you, such as bandaging and who did it, etc. I'll show you more when we get into demonstration. And the quick view is similar in that it has a time-stamped log of your vitals, heart rate and blood pressure. So if I go up here and I check my blood pressure, it comes in here as a timestamp. It says I checked my blood pressure and it was normal. Just so you know, there's a limit to 8 lines of information on both the activity log and the quick view. If you get more than 8 things going on, it's going to start bumping off the first ones and keep the most recent ones. Okay. That's what you need to know about the medical interface.